hemophilia is inherited disorder or not? Hemophilia is mostly inherited disorder. It is mainly comes from his or her mother. It actually happened in those family who has previous family history regarding hemophilia. Usually 70% patients who have hemophilia, they have previous maternal uncle's bleeding history or hemophilia or any other close relative who was suffering from hemophilia. But in case of 30% hemophilia patients, there remains no family history of prolonged bleeding or any kind of bleeding disorder or hemophilia. In case of hemophilia, mostly children's first come to doctor with bleeding manifestation, that is mostly seen around the knee joint or any other elbow joint, ankle joint, and there is also history of prolonged bleeding or swelling in the intramuscular vaccination site. In case of hemophilia, we have to do some precautions, like we have to apply pressure with ice application to the localized bleeding site, and after that we have to attend the proper hematologist doctor to rule out the bleeding disorder as hemophilia. After diagnosis of hemophilia, usually we suggest factor therapy, that may be factor 8 and factor 9, that is mostly depending on the diagnosis, that is hemophilia A or hemophilia B. It is a genetic inherited disorder, so we have to closely follow up the patients throughout their lives and monitor the bleeding history, bleeding manifestations. Then we can provide better treatment for those patients and they will survive a better quality of life. So if there is any history of prolonged bleeding after cut injury or any other unusual site of bleeding manifestations or swelling of the joints and pain after the intramuscular vaccination site, always you have to attend the proper hematologist doctor, diagnose the disease, and you have to receive the proper treatment.